A turquoise wand, a plain mailbox, and a test that could save thousands of lives. Could at-home cancer screening finally be here?
Today is May 17th, 2025. The FDA has just cleared the Teal Wand, the first at-home self-collection device for cervical cancer screening in the U.S. That's significant. After so many years of office visits and speculums, women can now collect their own samples at home.
Exactly. And it's not only about comfort. The Teal Wand is meant for women between 25 and 65 who are at average risk. They collect a sample themselves, no speculum needed, and mail it to a certified lab. The lab runs the same HPV test clinics use. So, how does this compare to the traditional pap smear?
The FDA's decision relied on the self-serve study. Over 600 women took part. The device spotted precancerous cells 96% of the time. That's nearly identical to clinician-collected samples. But here's what stood out to me. 94% of women preferred self-collection over an in-person visit. Why do you think that is?
Barriers like discomfort, tight schedules, and limited access have always made cervical cancer screening difficult for many women. If you could skip the speculum and the clinic, wouldn't you choose that? Especially when accuracy is so close. Plus, cervical cancer still causes about 4,000 deaths each year in the U.S., many of which screening could prevent.
The pap smear already cut cervical cancer deaths in half when it was introduced. So the chance for even more progress is real. Dr. Rama Makku at UF College of Medicine made a point. 99% of cervical cancers are linked to HPV. But testing positive doesn't mean cancer is certain. It just means closer follow-up is needed. Do you think most women know that? Or is there still confusion?
There's definitely confusion. HPV is very common and most infections never become cancer. The key is monitoring over time. What's important here is that the Teal Wand could catch abnormalities 3 to 7 years before cancer would develop. That's a crucial window.
Let's go into the logistics for a second. Teal Health plans to launch the device in California next month, then expand across the country. It's prescription only. The process is, go to getteal.com, schedule a virtual appointment, and a provider prescribes the kit. They're also working on insurance coverage and payment help. How much does that matter for getting people to use it?
It makes a big difference. Cost and insurance barriers can stop people from getting screened. If coverage is there, more women will try it. Education matters too. Women need to feel sure about doing self-collection. Dr. Makku is also looking at ways to build trust and improve access. Without those pieces, even the best tool might not reach the people who need it.
Let's circle back to accuracy. The Teal Wand uses Roche's Cobas HPV test, which has high sensitivity. If someone gets a positive result at home, what's the next step?
Usually, the next step is a colposcopy, a closer exam of the cervix at a clinic. The at-home test is just the first screen. A positive result doesn't mean cancer. It means more investigation is needed.
What about access outside the U.S.? Rates of cervical cancer are highest in low and middle-income countries. The Teal Wand is U.S. only for now. But is global expansion actually realistic?
It's possible, but it won't be straightforward. Cost and healthcare systems are big challenges. To make it work internationally, you'd need partnerships, subsidies, and a plan for local integration. The technology could help, but access is a whole separate hurdle.
The FDA's approval followed a breakthrough device designation, reflecting the need for new options. The U.S. Preventive Services Task Force is also mentioning at-home approaches in its draft guidelines. Do you think most cervical cancer screening could end up happening at home?
It depends on how well follow-up, education, and insurance support are built in. But this is a real move toward more accessible, less intimidating screening. If it results in more women getting tested and fewer deaths, that would be a genuine shift.
It's a positive development, not just for Teal Health, but for every woman who wants a reliable and private way to monitor her health.
Today, we've covered the FDA's approval of the Teal wand, the research behind its accuracy, and how it could reshape cervical cancer screening. Thank you for listening and for asking the questions that matter.
This has been a look at a key moment in women's health. Stay curious, stay informed, and we'll be back next time.